Turning 50 with MS is like unlocking a secret level, except instead of bonus points, you get bonus medical tests. Blood? Check. MRI? Check. Someone examining your reflexes? Check. Someone examining your dignity? Unfortunately, check. Today I'm breaking down the surprisingly important tests after 50 with MS, and which ones are just doctors being nosy. Ready? Turning 50 with multiple sclerosis feels like getting a new rulebook for a game you thought you already knew how to play. The field looks the same, the players are familiar, but suddenly the referee is blowing the whistle for things you've never heard of. You're still managing the classic MS challenges. The fatigue that feels like a weighted blanket, the tingling that shows up uninvited, the balance issues that make you look like you've had one too many drinks before noon. But now, you get a whole new set of bonus levels, complete with new tests. Some of these tests are incredibly helpful, others feel a bit like your doctor is asking nosy questions about things you'd rather not think about. So, which of these new tests should you actually pay attention to? By the end, you'll have a clear list to protect your bones, heart, brain, eyes, and bladder. No scary jargon, just plain language. You will understand why each test is important, what it feels like to get it, and when you should ask for it. This isn't about adding more worry to your plate. It's about taking control. It's about trading anxiety for a plan. You will leave here feeling less like a patient and more like the CEO of your own body, making informed decisions to stay strong, mobile, and independent. This is about giving you the tools, not the panic. So why does the combination of hitting 50 and having MS suddenly require this new expanded playbook? It's because MS and the normal aging process can have overlapping effects, and sometimes they team up. Think of it like a tag team. MS might weaken your bones because of steroid use or reduce mobility. Then aging says, hey, I can help with that, and also contributes to bone thinning. Some MS medications can put a little extra strain on your organs, and getting older naturally increases your risk for heart disease, high blood pressure. Your brain, eyes, and bladder are also affected by both long-term MS and simply getting older. That's why these tests matter, not just to find problems, but to establish a baseline, proof you can track over time and use to prevent crises. Are my bones slowly turning into chalk, or maybe some aged crumbly Parmesan cheese? The DEXA scan, dual energy X-ray absorptiometry, is the best way to find out. It measures your bone mineral density, how strong your bones are. Crucial after 50 with MS, steroids, less mobility, and vitamin D issues can lead to osteopenia or osteoporosis because thin bones break. Falling at 50 hits different than at 25. At 25, you bounce. At 50, you negotiate. Good news, DEXA is simple and painless. Lie on a padded table while a mechanical arm passes over you. Very low X-ray dose, less than a cross-country flight. It images your hip and spine in about 10 to 15 minutes. No needles, no dyes, no breath holds. Results tell you if bones are strong, thinning, or osteoporotic. If you're over 50 with MS, especially with frequent steroids, low mobility, or family history, talk to your doctor. If fragile, the plan may include calcium, vitamin D, specific meds, plus balance and strength exercises to prevent falls. You don't want to find out your bones are weak by breaking one. Surprise, your heart is also invited to this party, and it didn't bring a gift. Chronic inflammation, lifestyle factors, and some meds can increase cardiovascular risk. Add age-related risks like high blood pressure and high cholesterol, and your heart deserves attention. Protecting your heart protects your brain. Healthy blood flow keeps cognition humming. These are basics at regular checkups. Blood pressure and fasting lipid panel. High LDL leads to atherosclerosis, narrowing the pipes that feed heart and brain. Sometimes a coronary calcium score helps predict future risk and guide statin decisions. Think of it as a plumbing inspection. Fix the buildup before a pipe bursts. When your neuro asks about diet, exercise, and blood pressure, smile and say, I know, right? My body is a multi-talented performer. Taking care of your heart is one of the most powerful things you can do for long-term health with MS and beyond. Is this brain fog from my MS or just being 50 and forgetting why I walked into a room? MS can affect memory, attention, and processing speed. Aging brings its own normal slips too. That's why a baseline cognitive screening matters. It's not to diagnose a scary new problem. It's to empower you with information. Done in office in a few minutes. Remember a short word list, draw a clock, name as many animals as you can in a minute. I failed the memory test but passed the sense of humor under pressure test, calling it a win. Baseline gives you proof later, not vibes. If things change, you can compare and know what's MS, meds, or something else. Bring a trusted friend. Outside perspective helps. It opens talks about strategies, therapies, and treatments, even finding your car in the parking lot. It's about being proactive, not reactive. Knowing you're normal is the first step to protecting it. If you've ever had optic neuritis, you know it never truly leaves the group chat. Vision problems are common in MS, and subtle damage can linger even after recovery. Add aging changes, hello readers, and eye monitoring becomes crucial. Two key tests, OCT, optical coherence tomography, a quick, non-invasive scan of retinal nerve layers. Thinning can be an early sign of MS progression, sometimes before symptoms. Visual field testing maps your entire vision and finds blind spots you may not notice. It can feel like a weird video game, MS roulette, but it's extremely valuable. Aim for yearly tests. They provide objective evidence to guide treatment. OCT is basically a picture. The visual field is a few minutes of focus. Small time, huge return in knowledge and control. The super glamorous part, no one puts on posters. The bladder. MS can scramble bladder signals, causing urgency, frequency, incontinence, or retention. Ignoring it risks UTIs and long-term kidney strain. Start with urinalysis. Pee in a cup. Labs check for infection, blood, and abnormalities. If needed, a quick bladder ultrasound checks leftover urine after you go. Frequent issues? A urologist may do urodynamics to map muscles and nerves. Your bladder becomes a confused intern. It needs clear instructions and kindness. Treatments include pelvic floor physical therapy, bladder training, medications, and other options. Don't be embarrassed to talk about it. Getting bladder control back restores comfort, confidence, and independence. 4 quick hits that mimic MS symptoms and steal energy. Vitamin D level. Low is common in MS. It impacts bone health, mood, and immune function. Thyroid panel. Hypothyroidism causes fatigue, weight gain, depression, brain fog. Sounds familiar? Check TSH, sleep apnea screen, snoring, pauses in breathing, daytime exhaustion. An at-home study in CPAP can be life-changing. Depression anxiety screen. The emotional toll is real, and inflammation can play a role. It's treatable. These 4 are quick, easy, and can uncover hidden issues holding you back from feeling your best. Quick commercial break. If this gave you a clearer plan or a sense of control, please tap like and consider subscribing. It seems small, but it tells the algorithm this helps people, and it helps folks find their way here. Now tell me in the comments, which test surprised you most? DEXA, heart checks, or sleep apnea screening? No judgment here. Your story and questions matter. They can spark a conversation that helps someone else. You've got your list. Now approach your doctor as a teammate. Get organized. Write questions and concerns. Don't rely on memory. Include all medications, supplements, steroid history, and any falls or stumbles. Frame requests as questions tied to you. I'm 50 and had several steroid rounds. Would a DEXA make sense now? I've been more forgetful and I'm not sure if it's MS or age. Can we do a baseline cognitive screen? I had optic neuritis a few years ago. Is it time for an OCT to check my optic nerve? I read some MS meds can affect heart health. Since I'm on medication name, should we check cholesterol? Use simple, direct language. You bring the personal story. They bring medical expertise. Together you build the plan. Turning 50 with MS doesn't mean you're falling apart. You don't need bubble wrap. You don't need to give up your goals. It's time to be strategic, to protect your future, not just manage symptoms. These tests are tools that give you power, facts over fear. Think of your body as the star player, the tests as scouts, and your doctor as coach. Gather intel, make the plan. DEXA prevents sidelining fractures. Heart screens protect brain health. Cognitive baselines give proof. Vision tests catch whispers early. Bladder checks restore independence. I'm not falling apart. I'm just under extremely detailed medical observation. Which test surprised you most? Which one do you secretly avoid? Drop a line in the comments. Being honest here helps everyone. You've got this.